So there are a lot of well validated triage systems, and some of them I'll list it out. I'll list out some of them. Where SALT. Where SALT is nothing but S stands for sort the patient, then assess as A for assess. So there are a lot of well validated triage systems. I'll list some of them. So S for sort, and A for assess, and L for do some life-saving interventions. On the field triage, if there is a torrential bleed, and try to stop that bleed, apply some compression dressings like that. So in case of tension pneumothorax, in certain ICD, or if in ICD equipments are not available, you can at least insert a needle at the second intercostal space. So some basic life-saving interventions should be done at the field level, and then transport the patient. So that is what T stands for, transport the patient. So that's what the triage system, one of the important or the most commonly used is this system is the SALT system, where S stands for sort, A for assess, and L for do some life-saving intervention, and T transport the patient then. Next is START. So it's also very simple. ST, simple treatment. So it's very simple, right? Simple treatment followed by AND. Simple treatment AND. Rapid transport. Do some simple treatment and immediately transport the patient out of the disaster scene. So START stands for simple treatment and rapid transport. And next is jumpstart. It's nothing but a pediatric version of START. So for a pediatric patient, you have to act even more faster. So that's why it's called as jumpstart. So pediatric version of START is jumpstart. And next is DIME. It's the most similar thing, like we discussed red, yellow, green. So that is this DIME. D for delayed. So delayed means interventions, definitive interventions can be delayed. This is yellow, right? Delayed patients come under yellow. I is immediate. That is the patients requiring immediate interventions. So this comes under the red category. And M is minimal, where these patients come under the category of green, minimal injuries. They come under the category of green. And E is expectant. So these patients are expecting death. So they are expectant. So they are moribund patients. They come under the category of, or they categorized under black. So these are some of the lists of the triage systems. So SALT, START, jumpstart, and DIME.